afternoon, and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my co-host with Dr. Loreena Ryder. We're here each and every week to help guide your journey towards wellness, but we like to do it simply, without all of that horrible medical terminology that everybody hates. We're here to help you with practical solutions to help you on your journey towards wellness. It's simple, it's natural, and it works. If you're still struggling with your health, you can come see us at Naturopathic Physicians Group to help get your life back.
So topic of the day today is PCOS, stands for polycystic ovarian syndrome. Worldwide, PCOS affects 6 to 10% of women, making it the most common endocrine disorder in women of childbearing age.
Now, even if you're a man, you should listen to this episode because you might learn a lot about your partners out there that might save your life.
Yeah. And we're also talking about testosterone today, but we're talking about testosterone in females because it is a part of the PCOS picture. PCOS is considered a hidden epidemic. 1 in every 10 women across the world is diagnosed with PCOS.
And when I say it might save your life, if men paid attention to their partner's hormones, there'd be a lot more happy men and a lot more happy women and a lot less death out there. Because when you're not listening and not paying attention to your partner, you're more likely to say that stupid thing you're not supposed to say.
Yeah, might save some marriages.
This is a life-saving episode.
Right. So let's talk about testosterone a little bit. It is not just a male hormone. Females produce and need testosterone also. And today we're going to talk about the role of testosterone in females and why this male-dominant hormone is also important for females too.
So this condition, polycystic ovarian syndrome, PCOS is how we're going to talk about it throughout the day. Again, it generally affects childbearing age females, but it can be different times throughout their life as well. But it causes ovaries to become enlarged and you'll develop small cysts. This condition often will show up right around the first menstrual period. So it can be anywhere from 11-year-old till 14-year-old. And sometimes if they're drinking a lot of cow's milk, 9 and 10-year-olds. And if you're not drinking any hormones, maybe 15, but that'd be late. But this can develop later and it can show up at any time.
Yeah, let's talk about some symptoms that you might experience with PCOS. Now, there's a variety, just like there with any diagnosis or indication, but a diagnosis of PCOS is made when you have at least 2 of these: irregular or infrequent periods, too much androgen, which is testosterone, and polycystic ovaries.
Now, you do have to remember that when a girl is going through their early signs of puberty, even if you've talked with them, they might not understand cycling and all the other stuff too. So if they start complaining about symptoms, definitely take them serious and don't just chalk it up to, oh, you're having period cramps. It's very important when they're starting their period that they are regular right away. That 28-day cycle is very real. And not understanding that can lead to confusion for them and potentially a non-diagnosis that could be affecting their day-to-day life.
Yeah, when we're talking about irregular or infrequent periods, so this is having few menstrual periods or having periods that aren't that regular 28-day cycle. These are common signs of PCOS. So is having periods that last for many days or longer than a typical length is for a period. So you might have, for instance, fewer than 9 periods a year. You really should be having 1 a month, so you should be having 12. If those periods occur more than 35 days apart, these are all signs to go get checked out and see what's going on at your naturopathic doctor's office. Because if you let this go, and as you get older and in your 20s and 30s and may want to start having a family, you may have trouble getting pregnant.
And too much testosterone is a big tell. It's one of the things you need to get this diagnosis. So it's a condition called hirsutism. And again, it can cause body hair and facial hair even in females. So in med school, did you remember this term because it sounds like hirsute?
No.
Oh, see, that's how I remember. It's because she has too much testosterone. She's got body hair, so we called it hirsutism. That didn't work? That's how I remembered it.
I've never heard that.
Oh, good. You learned something today, too.
Yeah.
And then there's also the polycystic ovaries, so the cysts forming around the ovaries. But you do not have to have cysts in order to get this diagnosis. It's a common misconception. They're like, how can I have polycystic ovarian syndrome or PCOS if I don't have cysts? But if you have the high testosterone, the high androgens, and you're infrequent on periods, this might be your condition, even if there is or isn't a cyst.
Yeah. Back to the hirsutism. So just to define this a little bit for you, this can be dark, coarse facial hair in females that grow in a male-like pattern. So that would be located at the upper lip, the jawline, the chin, the chest, and the back. Sometimes severe acne and male pattern baldness can happen too. So that would be like baldness at the temple area of the hairline. So that's just to define the hirsutism.
So since you always do the three little pigs, I can say not by the hairs on their chinny chin chin. It's my turn this week. They should not let me talk about female hormones. I'm going to be in so much trouble after this episode. But other conditions that are associated with PCOS, obesity is a common one. Signs and symptoms: when people are overweight and very overweight, they are way more likely to have PCOS. It is a very common thing for people that are overweight.
Insulin resistance is another condition that's associated with PCOS. This is when cells in your muscles, fat, and liver don't respond to insulin. Insulin helps control the amount of glucose in the blood. So this results in a buildup of glucose in the blood and can eventually lead to type 2 diabetes. By the age of 40, 40% of PCOS women will have pre or full-blown diabetes. So this is just one more reason to get this taken care of earlier.
And if you download our podcast on your Apple or Google Play Store, we did a whole two-part segment on diabetes, both the conventional world of it and the naturopathic world of treating and trying to prevent diabetes. So PCOS and diabetes, again, 40%, that means 2 out of 5 people that have this condition, and 10% of females have this condition. So do the math. It's 2 out of 50 people are going to have diabetes with their PCOS. It's a really, really prevalent problem. And again, infertility. So there's so much money out there being spent on fertility treatments, and this could be one of those causes of why somebody is not having children during childbearing ages, even if they're trying. If they're having the hormone imbalance and they have the PCOS, it's very difficult to get pregnant.
And PCOS patient, the physical look of a PCOS patient may not be what has typically been known as. So when people say, oh, PCOS, they're thinking someone who is overweight and has the hirsutism, but you as a PCOS patient may not particularly have those characteristics. So it all depends on labs and clinical presentation and what's going on inside your body. So thanks for tuning into Your Health is Wealth. We're doctors Loreena Ryder and Stephen Katz from Naturopathic Physicians Group.
Every single week I do a segment called What Isn't Your Doctor Telling You? This is not an anti-doctor segment. However, if you are seeing your primary care physician and you can't get any questions answered because they don't know the answers, or they kick you out of the room before you have more than 3 minutes of time, you might be getting some things missing in your appointment. So I like to do a segment to where I can fill in some of those gaps that are likely missing in your 3-minute appointment with your primary care physician. So, on this note, since we're talking about PCOS, polycystic ovarian syndrome today, one of the most common treatments, now we'll get into treatments later on, but one of the most common treatments they do for PCOS is to give them either metformin because of the blood sugar issue that is associated with it, or they give you birth control pills because of the hormone issues associated with it. But did you know, and most people that are treated for this don't know, that birth control pills can reduce the absorption of B12 in your body? And metformin can reduce the absorption of folic acid in your body. Both of these B vitamins are essential for energy, brain health, life. Therefore, if you are being treated for PCOS, you may want to get your B vitamins checked, as these deficiencies can be linked to many other health conditions. And if your doctor has never heard of this, you might want to find a doctor who has, because it's a very real thing.
Yeah, and that's just listing a couple of the things that oral contraceptive pills deplete in your body, right?
Yeah, big time.
Yeah. Okay, so let's...
But I do understand them. Now, I didn't say I like all of the effects of them, but there is one effect I do like of them, and it's birth control.
What it's designed for, yes, I get it.
When you've got the children of the corn at home, just kidding. I love my children.
And they like being children of the corn, too.
They do like, they are totally me, and they're my wife, so they're definitely children of the corn.
Let's talk about some causes of PCOS. So the definitive cause of PCOS is actually unknown, but what we're going to discuss here today is what is thought to have cause PCOS. So let's talk about endocrine-disrupting compounds, otherwise known as EDCs. These are environmental pollutants like plastics, water and air pollution. That's just a few of them. There's many more. But our endocrine system consists of glands and organs that govern our hormones. This controls our metabolism, energy, reproduction, growth and development, our mood, and many other things. EDCs disrupt our hormone signaling. This is important. So just think about being on your commute to work, driving, and everything is congested. You're breathing in exhaust. You're breathing in tire breakdown plastics. You're having a hard time reaching your destination. Everybody knows how it is in traffic. So this is the same thing with hormones and EDCs. They're involved in preventing the hormone signaling. Basically, EDCs clog up the pathway that allow your hormones to get to where they need to go.
Yeah, one of the common ones out there are called phthalates, spelled with a PH and then TH. So it's phthalates, but it's actually pronounced phthalates. These are found in hairsprays, perfume, nail polish, soap, shampoo, detergents. So basically everything you're using in your house every day. And then, of course, people are very familiar with the pesticides out there that are sprayed upon all your foods. And that's the fungicides as well, the herbicides, insecticides. All of these disrupt your hormones. So they will cause an imbalance in your system. Eating them, you might not feel it right away. Some people are very sensitive to these, but over long-term exposure, if your body cannot remove these chemicals out of your body, it will cause endocrine-disrupting, hormone-disrupting problems in your body.
Yeah, basically, especially plastic. Plastic looks a whole lot like estrogen as a chemical structure, and it will be a squatter. It will be a squatter on your hormone receptor and just sit there and take up space. Yeah, squatters are a problem.
That's a good thing.
No, it's not.
No, the squatters aren't a good. That's a good term. I should have said it that way.
All right.
My bad.
So also PCBs, polychlorinated biphenyls, are coolants and lubricants used in fluorescent lighting. This was banned back in 1979, but it does still exist in our environment. That's another thing that is an endocrine disrupting compound. DDT, an insecticide that was banned in 1972, but still exists in our environment. Plasticizers. We did an episode on plastics that talks about phthalates, benzoates, adipates. These things make plastics more pliable. They are endocrine disrupting compounds.
And don't be fooled when people say they haven't used that in 30 years. But if these chemicals have a half-life of 30 years or 40 years, which some of them do, that means they're still 50% potent 40 years later, which means they're still in the environment 200 years later. So understand that just because they were banned, like lead was outlawed in 1978 in paint and in a lot of products, it's still plenty out there. So don't be fooled by, oh, it's been 40 years since they've used it. It's in your body.
Yeah, it doesn't just disappear. Dioxins are a byproduct of pesticide manufacturing. There are polyaromatic hydrocarbons, PAHs. This is a byproduct from burning coal, crude oil, gasoline. This can also form while cooking food at high heat. So flame retardants, I get it, why they put it on infant clothing, because you don't want your infant to burn up, but it is horrible. I would think you would grab your infant before it's on fire.
That might be the greatest sentence ever said on you don't want your infant to burn up. I second that motion. I did not want my infants to burn up.
I still don't like the flame retardants put on those clothes.
Oh man, this is radio gold. There's also parabens, preservatives that are found in most cosmetic products, furniture. When they take off that product, when they are spraying your furniture that they have to bring to your house, there is a thing out there called off-gassing. Those chemicals are now in your house. It's why your house smells like new furniture for a while. And then bisphenol A, also known as BPA, is found in plastics, water bottles. That was the big problem with infant bottles back in the day, as they became BPA free because they were giving these infants these neurotoxic plastic chemicals.
Chlorine byproducts. So this is chlorine you're using in your swimming pool, in-home shower water, and tap water, because yes, tap water does have a fair amount of chlorine, sometimes more than your pool does.
And soap. The most common ingredient in a lot of those household soaps was triclosan, Triclosan. It's antibacterial, so they put it in soap because it would kill off the bacteria. The thing is, this is a toxin, and it's horrible for you. It would kill off the bugs on your hands, but it's horrible for you. But here's a little known fact. This isn't a what isn't your doctor telling you segment, but it's still a fact. They started putting this in toothpaste. So when you're brushing your teeth with, and they wanted to make it anti-cavity toothpaste, they would put soap in your toothpaste, the ingredient for soap in your toothpaste. It is a toxin. So think about that. How many times when you were younger, when you would say a bad word, your parents would say, I'm going to put soap in your mouth. Ha! If you're a kid now, you can just say, I already do. I just brush my teeth. Done. You can cuss all you want. Remember that.
Cadmium is from secondhand smoke, and unfortunately, there's cadmium in chocolate. So we just gave you a really long list of endocrine-disrupting compounds that are in our environment we are exposed to every single day that can contribute to PCOS.
Now, how do they test for things like that? If you've got PCOS, they're going to do some testing. So what are the most common tests? They're going to run your hormones. Conventionally, you got to look at the hormones. Again, diagnostically, you got to check the hormones. So testosterone, estrogen, progesterone, these are very important, but PCOS is associated with normal levels of estrogen and progesterone, but your testosterone is too high.
Sex hormone binding globulin is something that should be checked. Low levels of this are associated with insulin resistance. Also, fasting insulin and glucose should be checked. High levels of both of those are associated with PCOS.
But since one of the diagnostic criteria, not required, but one of the diagnostic criteria are those cysts around the ovaries, and so a transvaginal ultrasound is an easy way for them to be able to visualize the ovaries and see if there's any cysts. But again, you can have PCOS without the cysts.
You can also check your LH and FSH. These are basically signals from your brain to the ovaries. And if they're high, that's telling us that the brain's kind of screaming, saying, hey, something is wrong here.
So traditional treatments for this, birth control pills, number one. I hate that they jump onto this. Basically, anybody who's having a problem with their period, here's birth control pills, that's going to fix it. That's pretty much the conventional route. We see this all the time, and they totally disregard that when you give the body a hormone, it stops making those hormones on their own. So when they try to get off of the birth control pills, it's not easy, and it oftentimes causes a lot of side effects.
And then they jump right back on it because they don't want the side effects.
Yeah, because their periods become horrible again, and then they kill all the people in their lives.
Statins are another traditional treatment, believe it or not. Prescription statin medications actually help control elevated cholesterol, which is associated with obesity and insulin resistance, but it can be given to PCOS patients as well.
And there's an estrogen modulator that promotes egg production called clomiphene. They will use that as well, but it's not usually the first go-to like the birth control pills is.
Spironolactone is a pretty common anti-androgen, so anti-testosterone prescription medication given since high testosterone is one of the things that leads to the hirsutism, that facial hair growth in females.
So thanks again for tuning in to Your Health is Wealth. We are the doctors from Naturopathic Physicians Group, and today we are talking about female testosterone and PCOS.
Dr. Ryder here with your tip of the week. Let's talk about PCOS and hormone disruption that can be caused or worsened by environmental factors. Now, we touched on this earlier where we gave you a whole list of endocrine disrupting compounds. So I just want to talk about plastic. Use as little plastic as possible. You'll want to opt for glass or stainless steel containers. And this isn't just for PCOS patients. This is for everyone because you don't want your endocrine system clogged up with these squatters, like I mentioned earlier, the plastics. These harmful environmental factors, the EDCs, like plastics and chemicals that we use to live basically with every day, they're disrupting our hormone receptors and our hormone signaling. It's really hard to avoid these environmental pollutants. We package and store things in the food, with our food and drinks in the refrigerator in plastics. We buy them in plastics. We breathe in plastics. I talked about your commute to work, those tire breakdown particles that are in the air and you breathe them in through your car. Some microplastics have actually been recently found for the first time in human blood and in pregnant women amniotic fluid. Is that, yeah, that's it, fluid. I'm thinking car, that's wrong. No, it's fluid in there. So these materials, the endocrine disrupting compounds, the plastics, the pollutants, they settle in our bodies and they destroy our hormones. So to attempt to reduce the exposure to these chemicals, use as little plastic as possible. Do not microwave in plastic or styrofoam. Avoid BPA. Store leftovers in glass containers. And you will still, it's hard to go 100% plastic free. I've tried it. It's impossible. So you're still going to have to use it every now and then, but good luck to you.
So plastics are bad, rubbers are good.
Not when you're breathing it in.
Oh, fair enough. So we were talking about the conventional medicine treatments for it. One of the most common ones we talked about earlier is metformin. Metformin is a prescription medication used for type 2 diabetes because it helps improve insulin, which then lowers the blood sugar. Again, we talked about how folic acid is depleted with that. So again, speak with your doctor about this.
Hair removal procedures. Did we talk about this yet? I don't think we did.
No, we didn't.
So electrolysis, laser hair removal, and topical hair removal creams can address hirsutism.
It's a
I have
symptom
mixed
treatment.
feelings
That's all
on
it is. It's gonna cause hair loss. And on your worst enemy, you put it in their shampoo. It's one of those things that just does the trick, but it is a symptom. It's not fixing the problem. And if it is full of a bunch of other chemicals, you might be worsening the problem when you're using that.
Yeah, there's also in vitro fertilization therapy. Now, remember, we're talking about traditional treatments here. This assists in pregnancy if PCOS has caused difficulty with conception. So this method uses medications and surgical procedures to help facilitate pregnancy.
So naturopathic testing, the first thing, again, hormones. We talked about that as they do that for conventionally, but I'm talking a deeper check on the hormones. It's not just about your estrogen E2. It's not just about progesterone, testosterone. You want to see an in-depth breakdown of your hormones. You need to see how they're breaking down. You need to see the byproducts. You need to see the precursors. If your doctor doesn't understand the pathways of the hormones, which many do not, you're not going to be able to treat this problem. You're just going to be on drugs to try and treat this problem. Understanding the full breakdown of your adrenal glands so you know all your sex hormones, all your stress hormones will allow you to be able to treat PCOS and be able to stay off the drugs.
Yeah, and you can test this in more than just the avenue of blood. You can get a really great picture of the hormones with a 24-hour urine test. It will check your metabolites. It'll check more than just the 4 or 5 hormones through blood. So this will give you a really great amount of information.
And a very common thing, we've done a whole episode on this, is methylation issues. If you have PCOS, you have a very high chance that you have a methylation problem and your body is not able to break down a lot of vitamins, especially those B vitamins. So if you have a methylation issue or you've never tested it and you're interested in testing it, we can definitely do that testing at our office, Naturopathic Physicians Group. But methylation issues does increase your risk for all genetic conditions, all PCOS, hormone issues, etc.
Yeah. The term you might have heard would be MTHFR, genetic mutation, stands for methylene tetrahydrofolate reductase. 60% of the population has this SNP, so it's probably good to check. Also, heavy metal testing. We test for heavy metals in our office. This can affect the methylation ability as well. This also can affect our detox pathways, which would affect our hormones and our hormone imbalances. Heavy metals are things like lead, cadmium, aluminum, and arsenic. And if you're wondering, how would we even get those? I wasn't in a war or something like that. It's just living on Earth, breathing, drinking the water. That's how you get exposed to heavy metals.
So earlier when I said how I remembered the female body hair was called hirsutism, the methylene tetrahydrofolate reductase is spelled out MTHFR.
Oh, yeah.
So we always called it the mother gene
Yeah.
mutation, and I did not say the bad word. You did not make it. I'm speaking the medical terminology, but that's how we remembered it.
When you look at it, it does look that way.
The mother fur gene.
Let's talk about some naturopathic treatment options. So this is the good stuff here. So we're going to talk about what we do to help PCOS patients in our office. Number one, exercise. Exercise reduces insulin resistance and obesity. Your body just simply functions better in all aspects whenever exercise is part of your daily routine.
IV therapy for detox. We've talked about IV therapy in many conditions. When you have a problem with detoxing, you have to be able to open up those detox pathways. If you're full of chemicals, if you're full of toxins, whether it be heavy metals or just plastics, as we're talking about, is one of the big common causes of PCOS, you've got to be able to detox properly. So nutrient IVs with glutathione. Glutathione opens up the liver and allows the body to flush out toxins. And we've talked about chelation therapy, which is heavy metal detoxing. If you've got any toxic burden in your system, you have to remove them or you cannot get to the bottom of your conditions. They're not cures getting rid of these toxins, but the toxins are obstacles in the way of your cure. You can't just ignore those toxins being there because they're going to block you from being able to get better.
Yeah. And work toward a green lifestyle. Now, what do I mean by that? That's what we talked about earlier by trying to avoid plastics, trying to avoid endocrine disrupting compounds, chemicals, that kind of thing. Eat organic whenever possible. If you can't purchase organic all the time due to budget, look at the Clean 15 Dirty Dozen guidelines from the Environmental Working Group. They also have information on which fish is cleanest. It's a really great website.
And how about pay attention to what you have in your house? It sounds obvious, it sounds easy, but it's actually very difficult because the world is so full of those chemicals. If you are using environmental toxins and you're spraying it everywhere, if you are using 12 pounds of makeup every day to walk out of the house, if you're using shampoo, if you're brushing your teeth with that soap, if you're using all of these things, you are creating this toxic burden in your system and you are going to affect your hormones. Doing all of those problems will increase your risk of the PCOS, but it'll increase your risk of bad periods in general. It'll make your PMS worse. It will make your menopause worse.
Yeah. And just take your shoes off before you go into the house because you've tramped around on
Unless your feet smell.
ucky stuff.
Then keep them on.
You know what? I'd rather have stinky feet than endocrine disrupting compounds in my house.
Just get non-plastic shoes.
Wipe your feet on the rug before you go inside. And also dust. Endocrine disrupting compounds are actually carried around by dust. So if you're breathing in the dust in your home, you're breathing in those plasticizers and everything that's hanging on to them. So if you feel like you're just not getting to the bottom of your health issues, give us a call at Naturopathic Physicians Group in Scottsdale, Arizona.
So we were talking about different treatment options before we get into supplementation. We talked a little bit about detoxing earlier, but there's different types of thinking when it comes to detoxing. One of them is you have to drink enough water. You're supposed to drink about half your body weight in ounces of water each day. If you don't have enough fluid, you can't pee out the toxins. So they just recirculate throughout your system. So you have to make sure you're hydrated in order to do that. Sleep plays a huge role, but it's also if you are having trouble getting pregnant. This is a really important thing because you have to detox before you become pregnant. And that includes both the female and the male. So if you are a male out there and like to blame the female for all of the infertility issues, the truth of the matter is it's a 50-50 game. Your sperm is just as equal as the egg, and so you have to be able to detox both of them. If those fishes aren't swimming, then you ain't going to get pregnant. So basically, and how soon should you do that? About a year. You should start detoxing a year before you want to get pregnant because you got to clear that stuff out so your hormones can be regular so you can get pregnant.
Yeah, and those endocrine disrupting compounds that we talked about earlier, research has shown that the EDCs can affect the sexual organ development in up to 4 generations of offspring. So if you detox, your generations threefold down the way from you will thank you for that, or fourfold rather. Shower filters and tap water filters in your sinks, these are very important. So aerosolized water is a huge source of endocrine disrupting compounds entering our bodies. Most of the time, you can even smell chlorine in the tap water. At one time, prescription medications were disposed of by flushing them down the toilet, both by average people and by the authorities. This was standard procedure in the past. So our water here on Earth is the same water as it always has been. It's just recycled. And our water treatment plants really aren't equipped to remove these chemicals and drugs. So if we don't filter out our shower water, our tap water, we breathe it in, we drink it, we absorb these chemicals in our bodies.
I remember reading a study where they were testing the water and they found a boatload of antidepressants and a boatload of painkillers in the water supply in the city. And I thought about it and said, if we have painkillers and antidepressants in the water, why does everybody feel like crap and act like I'm not going to make you press the beep button, but basically it doesn't make sense. We should all be happy and feel good, right?
Yeah, if we got drugs in our water.
But we got drugs in that water, so I don't get it. They didn't work. So supplementation. So when it comes to treatments, we always tell people we don't want you to start or stop any new treatments out there. When we talk about supplements and medications, we are giving you information that we have used with our patients before. But as we always say, we individualize our treatments with our patients. So what we say in here does not mean it is right for you.
Yeah. Let's talk about B vitamins. They're really helpful for PCOS symptoms. B9 or folate. And if you are one of those 60%ers that have the MTHFR genetic mutation, you would need methylfolate. Yeah, that one. This supports our detox pathways. It also assists in metabolic body functions such as blood sugar regulation and electrolyte regulation.
B6 is also known as pyridoxine. The activated form is called pyridoxal 5-phosphate. If you have that methylation issue, you want to have the activated form. This one helps with glucose balance, helps with mood regulation. It's also found in a lot of sleep formulas along with melatonin because it can help some people sleep. However, some people, B6 they're very sensitive to it and it'll keep them awake. So again, talk to your doctor.
Yep. B12 is also helpful. Cobalamin or methylcobalamin would be the methylated version. This is really great to help with insulin resistance, among other things, but that's just the one helpful item for PCOS.
That is a very important one to understand because it's the methylation forms. There's also adenosylcobalamin out there.
Cyanocobalamin, those are the ones you don't want.
Correct. Cyano sounds like cyanide. That's the way to remember not to use that one, but that's the worst form of B12 out there. And I hate to tell you, on the conventional side, that's the main one they use.
Inositol is really great. This can be sometimes referred to as vitamin B8, but it really isn't a vitamin. It is a sugar that helps your body process insulin. Also known as D-chiroinositol or myoinositol, which is a more bioavailable form. So inositol addresses the insulin resistance portion of the PCOS. It's involved in making glycogen, which is the storage form of sugar in your body, as well as the uptake of glucose. And inositol also mediates the follicular signaling hormone, that FSH, that can be screaming on the blood labs if your hormones aren't working correctly.
Yeah, inositol is also found in a lot of products that help with anxiety because it helps with your neurotransmitter balance as well and calms the system down. So it's a nice one for hormones and a nice one for relaxing. And it's a really nice one if the hormones are causing you not to be relaxed. So again, kind of kill two birds with one stone.
Yeah.
Amino acids are big when it comes to PCOS. Amino acids, the most common ones are glycine, taurine, methionine, and glutamine. These help with inflammation. They help with the insulin resistancy. The methionine, again, meth, not methamphetamine, it's methylation. Methionine supports that methylation. It supports the detox pathways. And the glutamine helps with, it's an anti-inflammatory, helps with oxidative stress. It's also really good for your digestive tract, which controls so much of our body's inflammation.
Yeah. Minerals are also really important to help reduce PCOS symptoms. I'm huge on minerals. I think a lot of people are deficient. Selenium helps decrease serum insulin levels and reduce oxidative stress. Chromium is a blood sugar regulator. Keep in mind, if you have sugar cravings, you might be low in the mineral chromium. That might be causing those sugar cravings. Calcium is a really great mineral to help with ovarian egg health. And magnesium, oh my gosh, I can't say enough about magnesium.
Good quality magnesium.
That too.
But yeah, magnesium, insulin, muscle relaxant, anti-inflammatory. It's an amazing thing. But again, there's so many forms out there. So you have to use the right form. It's for you. And that's something that if your doctor only knows one form of magnesium, you should find another doctor.
And zinc. Zinc metabolizes fats. That's helpful. It also helps with insulin metabolism and hormone metabolism.
So here's a hormone that's important, melatonin. A lot of people have heard of melatonin because they're like, oh, I use that for sleep. That's huge. But what they don't know is melatonin is also helpful. Melatonin is also really good at helping the body remove BPA from your system. It's also protective to sugar. It's also got anti-tumor effects. So again, we don't usually talk too much about cancer and tumor, but just like lastly, because I don't want to get shot. But in general, high doses of melatonin when used correctly has been shown in studies by conventional doctors to be protective for gut cancers.
Oh, yeah, definitely. Let's talk about some essential nutrients that help PCOS symptoms, and those are going to be your omega-3 fatty acids. This helps with so many different things, but PCOS is just one of those. Omega-3s support the metabolic and endocrine functions. So one more reason to eat your fish, eat your seeds and nuts, and take your fish oil. And
detox, again, we've said it a bunch of times. You have to make sure your detox processes are working. So NAC is N-acetylcysteine, produces glutathione in the body, which is a detoxer. It supports the egg quality when you use NAC. It helps with insulin receptors, and it allows the toxins to be removed out of the liver.
Alpha-lipoic acid, otherwise known as ALA, is another great antioxidant that improves insulin resistance. It's anti-inflammatory and detoxifying, and that's one of the IVs that we offer at Naturopathic Physicians Group, but you can also take it as a supplement.
And protect your gut. 80% of our inflammation, again, comes from the digestive tract. So probiotics have been shown to help people with PCOS. It helps their metabolism, helps improve their blood sugar. It helps decrease the testosterone biosynthesis. It's something that when used correctly, can have a great benefit to your body.
And just a side note, back to the magnesium gets rinsed out very quickly with stress, and we all have stress. So that's one more reason to take that magnesium.
So thanks again for joining us today on Your Health is Wealth. We hope you enjoyed this show on PCOS, and we will see you with another new episode, and have a great weekend.